everyone. So excited to chat with my doctor again. And today we're going to talk about what to expect at your first fertility appointment. So feel free to reintroduce yourselves if people didn't see our last video.
Hi, everyone. I'm Dr. Jenny Nichols, and I'm with Sincera Reproductive Medicine. I think this is just kind of a basic idea of what to expect for your new patient visit. And in this pandemic we're living in, obviously it's a little different, maybe a telemedicine visit, which is kind of pretty much what we're doing right now, a Zoom meeting. It reduces the risk, so you don't have to go face to face. But it's just talking to your doctor. It's bringing any information you already may have. It's if you've met with your OBGYN and you have any information, bringing it to them or sending it to them beforehand. But it's letting them get to know you, give them an idea of what you already have and telling them what you expect or want when you come in.
So it's really just like, hey, so let's say just a lesbian couple come in.
Yep.
And, we don't have any known fertility issues. And we're like, hey, we want to have a baby.
Yep.
What do we do?
Yep, basic idea is I'm saying, okay, I want to get some information on you as a couple. I want to say, I'm going to talk to you and get your medical history. I'm going to obviously ask both partners their age. I'm going to say any medical problems. I'm going to obviously ask the gynecologic history. So how old were you when you started your periods? How frequent are your periods? Do they come regularly? Every 28, 30 days? Are they really short? Are they really long? I'm going to say, do you have painful periods? Talk about any history of any sexually transmitted diseases. I'm then going to ask any surgical history, going to talk about social history. Do you smoke, drink any social alcohol, which I then immediately say it's okay. You're allowed to drink. I kind of throw in there. A lot of people do tend to, after things like inseminations or once the embryo may be implanting, that obviously most women will say, okay, I'm not going to drink at this point in time, or I'm going to hold off of drinking, kind of reassure them that it's okay to have a drink as they're going through this process. Talk about what they do for a living. Are they at high risk? Are they exposed to anything toxic? So really, it's just getting to know them, getting that medical history, talking about family history, mom and dad's history. One of the important things is how old was mom when she went through menopause, which is crazy, but obviously that gives us an idea of egg health. And then talking about, do they have any siblings and what are their siblings' history? Any family history of any birth defects, and then their ethnic background. So do they have any increased risk of genetic diseases? So that's kind of obviously for the in a lesbian couple, in the female partner who wants to get pregnant. But in a lesbian couple, obviously, both partners have ovaries with eggs and both partners have uteruses. So the cool part about a lesbian couple is you can use eggs from either. You can use uteri, fun word, uteri from either. And what are you going to do?
Right. Right. And then do you expect like blood draws, ultrasounds at the first appointment? Like all of that.
So obviously in the pandemic, since we're talking from, a Zoom meeting, it kind of gives us a chance to say, this is the initial appointment, and then we're going to talk about what we're going to do. In a non-pandemic world, usually we would do an ultrasound at that initial visit to say, let's take a peek at your ovaries and your uterus and see if we find anything that is unexpected. Do we see any fibroids? How do your ovaries look? In a pandemic world, we're going to say, hey, let's bring you in when you get your period, because then we can take a peek at your uterus and your ovaries at that point, and then we'll do blood work then.
Got it. Okay. So it kind of can potentially extend the
timeline
a little bit, depending on.
We would do it at that point anyway, because we would do that baseline initial ultrasound regardless, because it's the best time to take a peek at the ovaries and the uterus when a woman gets her period, right after that period. So it doesn't change much in relation to the timeline. I just think it's It's kind of giving that woman a chance to say, okay, we're going to start my testing when I get my period. And I know I'm going to do that ultrasound when I get my period. And whether her period comes in 2 days or her period comes in the next 2-3 weeks. Now, in a woman who has irregular periods, one of the things we're going to say is you don't have to wait for your period to come in the next 2-3 months. We will not make her wait that long. Right. We'll tell her, hey, we're not going to make you wait that long. We'll bring you in and we'll see what your cycles are doing. And if we need to, cool enough, we can bring on a period if we know she hasn't ovulated.
Right. Cool. Okay, awesome. Are there things that people should ask at their first appointment? Like just some tips if a doctor isn't necessarily going to bring it up, or some important things?
Yeah. So I think one of the good things to tell people is that you always should make sure you bring anything you already have. Make sure that your doctor is looking at your old records. Any concerns you have, make sure you bring up to your doctor. Make sure that they're looking at your old records. Make sure that you bring up your concerns. But I think the biggest thing is that you tell them what your goal is. If your goal is, one partner getting pregnant and the other one never wants to be pregnant, let them know. If your goal is that both partners want to be pregnant at a point in time, let them know that. If your goal is reciprocal IVF and you know that from the beginning, let them know. Because there's no way that a doctor knows that unless you're saying that. Now, the doctor should know to ask those questions, with a same-sex couple, but you have to say, hey, or say, we don't know what the options are. Please let us know what the options are. Because if you haven't looked into it, there's no way you're going to know that. And so definitely, obviously, if you're doing all your research and you're on the website and looking and watching these, you may have a better idea. But say, hey, what are my options? Because it may change what testing we're going to do. We may do testing on both partners to see how both partners' ovaries are functioning, to give the couple a better idea of maybe we start with this partner's ovaries first before this partner, if one woman's ovaries are doing better than the other, or talk about freezing embryos so that they're there for the future. But yeah, I mean, there's a lot of different options when you have 2 sets of ovaries and 2 uteruses. And sometimes some women say, nope, I never want to carry. And, sometimes both women have interest in carrying. So.
Right. Yeah, I think it's important to say, like, hey, we're not sure, maybe I will carry down the line, but I'm not sure. Even though I might be younger, my egg quality might not be as good. So maybe we start with me versus my partner, because my partners, they're like looking great, obviously, unless they're over a certain age or whatever. But just because you're younger doesn't necessarily mean that you would have a better chance at getting pregnant if there was something else going on.
Right.
So I think
I also think you have to expect the unexpected. If you think that one partner is going to carry, and just recently this happened in the practice, and a woman finds out she has a fibroid or something unexpected in her uterus, and she's now going down the path of needing a surgery for that fibroid and the myomectomy to take that fibroid out. Her partner said, well, maybe now I wasn't opposed to carrying and having a baby and carrying the child. And while she goes down the path of having a surgery for her uterus and she undergoes the healing, I'll look at getting pregnant. And then once that child is born and she's healing, then maybe she looks to conceive in the future. And so immediately, even though she was the patient that I saw initially, it switched and she became, hey, I'm going to look at carrying and I'm the patient. And it flipped right to her. Let's do the testing on her uterus and her tubes. And then we're going to flip back to here in the future.
Right.
So I think it's keeping an open mind. Yeah.
We flip-flopped. We originally started with Jordana and then switched over to me. And then we switched again the next time of, because the fibroid in her, there's just unexpected things that can come up. And I tell people that fertility, I feel like, is an emotional roller coaster, and to just kind of, prepare for the unexpected. You might have a plan, probably not going to go according to plan, but there are options and stuff like that. But I think, the first appointment, and I like to tell people, is that it's an interview for you too, like as a couple, to make sure that this doctor in this clinic is a good fit. Unless you're somewhere remote, there are other options if you don't find them to be a good fit. And, I think that
and for same-sex male,
yeah, right.
I was going to say, and for same-sex male couples, I think you have to go in with an open mind as well. You have to say, okay, what are we going to do? We're obviously looking at using donor egg and, a gestational carrier. I tell men that the rate limiting step is finding that gestational carrier. Obviously, you can look at, donor egg and whose sperm are you going to use? Looking for that gestational carrier, having an open mind. Do you want to have one child or more than one child? The idea of frozen eggs versus fresh eggs. And there's a ton of options out there. And the thing to remember is just keep an open mind. As you look at egg donors, you may say, yes, we think we want frozen eggs, but then you may say, but we really want to have more than one child, or we really want to consider genetic testing on the embryos, or we really want this, or this. And then your path may change as you're making those decisions. And you may then say, okay, but fresh eggs may be a better decision for us. And so it really is keeping an open mind along the way.
Right. And it's good to go to a clinic that has worked with same-sex couples before, because there are so many different options and of course, hetero couples as well, same options, but obviously we need the extra help and the extra steps, but to just have those options presented. And you can say, like, hey, we've had a patient that did this and this was really cool. And, just kind of to give people a sense of.
And I think one of the biggest things, just one of the most miscommonly used terms is, as I said that, and I use the words, is gestational carrier and donor egg versus surrogate. Is a traditional surrogate, just so everyone knows, is a woman's egg with the sperm, but she's carrying, and it was her egg, and she's carrying the pregnancy and then gives that baby up. Traditional surrogate isn't used regularly any longer because it was her egg and she's no longer going to care for or have that baby. And the problem is that gets really sticky legally because it is tied to her genetically. And traditional surrogate, although it's not unheard of, is a whole lot more difficult in the fertility world because it is and was her egg.
Right.
Versus the idea when you have, the capability fertility world-wise is a donor egg with a gestational carrier. And what happens is you're capable of using an egg donor, mixing with sperm, and then putting it into a gestational carrier where that gestational carrier has no genetic ties to that embryo. And then after she delivers the baby, that baby has no genetic ties to her.
Right.
And so when a lot of people come in, they say, I'm looking for a surrogate. And, although we understand what they're saying,
right.
It's not a traditional surrogate is not the right thing they're looking for. Got it.
Right. Well, we have lawyers on our database that do egg donor contracts, surrogacy contracts.
All they do.
Like we have all fertility and family formation stuff that if you are needing something like that, known sperm donors and stuff like that, there's a lot of legal stuff that goes on behind the scenes, just making sure that, genetic ties are severed, if that's how it's going to be, and all of that. So,
and a lot of practices, including ours, have a donor team. That's, anytime any couple comes in and they're using donor egg, donor sperm, donated embryo, we have a team that specifically just works with those couples to help in relation to, all of the things that are needed. The lawyers, the FDA testing, the psychological consults to understand any questions that may come up. more so just because there are the nitty gritty that go into all of it, and it is a process. It's helpful to have a team, even within a practice. So
definitely, and there's so many things that you don't even think about. We're just like, oh, I want to have a baby. I'm gonna, go get some sperm. We're gonna do whatever.
even afterwards, after you have the baby, the parts that go into the birth certificate.
Yep. And we've got blogs and such on that the birth certificate is not enough at this point in time to grant full legal parental rights. So, going through the second parent adoption, step parent adoption, confirmatory adoption, they have all different names in all the different places. But knowing that up front and having a clinic, that you can work with that knows all the different pieces of that can kind of inform you in the beginning is so helpful. So, yeah. I think we covered what to expect at your first appointment.
The doctor part of it, we are there to help get your information, to talk to you, to kind of give you an idea of what to expect as the testing and the process unfolds, but really just to welcome you into our practice and say, hey, we're happy to have you. This is what you can expect. We want to get your basic information and answer any questions you have, but really just say, welcome to our practice, and we're here to help you.
Awesome. Yeah. It's like getting the vibe, making sure it's a good fit. But we'll talk more about kind of the options that you would present to couples.
The options and the testing and all of it.
Yeah. But we'll talk about all that another time. But, well, thank you so much.
Thank you. Have a good day, everyone.